as the world reaches the hottest week yet this pandemic, and the number of global confirmed COVID-19 cases surpassed 1.4 million. Countries are desperately in need of masks, test kits, ventilators, and protective equipment. In this dire moment, China is taking responsibilities to donate and export medical supplies to meet the explosive demand under tight deadlines. It has provided assistance to 120 affected countries and 4 international organizations. However, here is what you see in some reports, which they falsely interpret China's effort and goodwill and calling some medical supplies exported from China defective. Financial Times published the article, "Countries Reject China Pandemic Product Batches" on March 29th. It said the Dutch Health Ministry said at the weekend it was forced to recall 600,000 face masks shipped from China on March 21st after they were found to be defective. The Al Jazeera also asserted the masks did not meet their standards when they were inspected. Part of the shipment had already been distributed to the health professionals. But that's not the complete story. There is a misunderstanding in this case. According to the preliminary investigation conducted by the Chinese side, the batch of face masks exported from China are for non-medical use, but it has been distributed to the local hospitals. Chinese manufacturer did inform the Dutch side about it before shipping them out. As the world looks to China to provide medical supplies for dealing with the coronavirus pandemic, more anti-China hawks have made a fuss about the quality of China-made medical products. There have been cases of defective supplies in Chinese exports. However, these products were made by unlicensed firms and have nothing to do with the Chinese government. In response on the quality issues, China strengthened quality checks and issued an order that regulates the exports of coronavirus-related supplies. The China's General Administration of Customs and Foreign Ministry say foreign buyers should purchase from Chinese companies that have government-issued registration certificates. Moreover, the standard system for medical protective products is extremely complex and varies in different countries. For example, across the globe, N95 masks are considered the gold standard of respirator masks. In the US, N95 masks are tested and certificated by the National Institute for Occupational Safety and Health, or NIOSH. As hospitals and governments hunt desperately for respirators and masks to protect doctors and nurses from the coronavirus pandemic.
Supplies across the country are dwindling. In Arizona,
I can tell you my biggest concern right now as an emergency room physician is the lack of PPE.
Main concerns? A shortage of N95 masks that can filter out 95% of airborne particles.
My colleagues that are practicing in New York City, they are literally running out of protective equipment.
They're running out of medications. Some hospitals don't have protective gear for staff.
And once you get to that point where you're drowning, you need a ventilator to stay alive, and we're running out of that equipment for people.
If we don't get ventilators this week, we are going to start losing lives we could have saved.
In the US, the FDA on last Friday allowed the use of more widely available masks and issued an emergency use authorization for KN95 masks regulated by the Chinese government. And they're almost identical in performance to N95 masks. China, already the world's largest producer of masks, with production of 20 million in 2019, including 2.2 million of surgical masks and 600,000 medical N95 masks. Now China produces 160 million masks a day with 1.6 million N95 masks. That's about 12 times what's made before. And now, as more cases emerge outside of China, it is repaying in kind the help and assistance received from countries earlier. During the first 2 months of the outbreak, it received donations from about 80 countries and 10 international organizations, including masks and other medical supplies. From March 1st to Saturday, China has exported medical supplies worth of 10.2 billion yuan, including 3.86 billion masks, 37.52 million protective clothes, and infrared thermometers 2.41 million, and ventilators 16,000, 2.84 testing agents, and 8.40 million goggles. Blame will continue to be pointed in all directions, but for now, at least until we make it through this crisis, hopefully the politics and blames can take a backseat to arriving at a heightened understanding for the benefit of us all.